Okay, let's go.
It really feels like ADHD is just everywhere these days, right? It's all over our social media feeds, it's a huge topic in schools, and a lot of us are even wondering about it for ourselves. So what's the deal? Is it a real epidemic, or are we just getting a little too quick with the diagnosis? Well, let's dig into the data and see what we find. I mean, who hasn't asked themselves this while falling down a social media rabbit hole? Is my phone breaking my brain? It just feels like our attention spans are shot, you know? Like we can't focus on anything for more than 5 seconds. It's this anxiety that we all kind of share, and it's the perfect jumping off point for this whole conversation. Okay, so before we get totally carried away, let's just get grounded with one key number. Scientists have looked at decades of research from all over the world, and they've landed on a pretty solid benchmark, about 7.2%. That's the estimated worldwide rate of ADHD in kids. Now, remember that number, 7.2%, because it's going to be super important as we go. All right, so if we're going to talk about all the controversy, we first have to make sure we're all on the same page. Like, what even is ADHD, clinically speaking? Let's break down the official definition. So the first thing to know is that clinically, ADHD isn't just, having a lot of energy or getting sidetracked easily. It's actually a neurodevelopmental disorder. And there are 2 words in that definition that are absolutely critical: persistent and interferes. What that means is, this isn't just a phase someone's going through. It's a long-term pattern that genuinely gets in the way of their life. At school, at work, you name it. And here's the thing, ADHD is not a monolith. It's not one size fits all. You can kind of think of it as having 2 main, flavors. On one hand, you've got the inattentive side. This is all the internal stuff, struggling to focus, stay organized, remember things. Then, on the other hand, you have hyperactivity and impulsivity. That's the stuff you can see more easily, right? The fidgeting, the restlessness, the blurting things out. And a person can have one, the other, or a mix of both. Now, all those official criteria can be a lot to remember. So here's a neat little trick clinicians sometimes use, a mnemonic. For the inattentive symptoms, you just have to remember to call for Fred. Yep, call for Fred. Each letter lines up with a core symptom, from C for careless mistakes, all the way to D for being easily distracted. It's a really handy way to keep track of what doctors are actually looking for. And there's one for the other side too. For hyperactivity and impulsivity, the mnemonic is runs fast, which honestly is pretty perfect, right? It totally captures that feeling of being driven by a motor, as they say, from R for running around to T for talking way too much. So between those 2, you get a really clear picture of what we're talking about clinically. Okay, so now we have our baseline, right? A clear definition and that magic number, about 7% worldwide. But here's where things get really interesting. This is where we hit a massive contradiction. If that baseline rate is pretty stable, then why on earth are diagnoses in some places going through the roof? This is where the story gets good. I mean, just look at the data from the United States. It's pretty startling. Back in the late 90s, the diagnosis rate was around 6.1%. See? Right in line with that global benchmark we keep talking about. But then, fast forward about 20 years, and it shot up to over 10%. That's a jump of nearly 70%. This is not just a rounding error, folks. Something big is going on. And get this, the biggest critics aren't always outsiders. This quote, this is from Dr. Keith Connors. People literally call him the father of ADHD. So the very guy whose research helped define the disorder in the first place, later in his life became one of its sharpest critics. He called the explosion in diagnosis a concoction, made up to justify handing out way too much medication. So if it's not a true biological epidemic, what is going on? What's pushing these numbers up? Well, researchers have kind of pinpointed 4 main culprits. First up, it often starts right in the classroom. Think about it. The youngest kid in the grade is just naturally going to be less mature, and they're more likely to get flagged. Then you've got the massive, and I mean massive, influence of drug company marketing. On top of that, you have doctors making diagnoses after super short appointments. And the last piece of the puzzle is a huge common misunderstanding about what the medication actually proves. And this last point is so important. It's called the medication response fallacy, and it's a trap a lot of people fall into. Here's the deal, and if you take one thing away, let it be this. Stimulants help almost everyone focus better. Not just people with ADHD, everyone. So if a doctor gives someone a pill, they focus better, and the doctor says, aha, see, you have ADHD, that is a massive logical leap. It's just not how it works. It's not a valid diagnostic tool. So, with this whole diagnosis dilemma, it's pretty clear we need a smarter way to think about treatment, right? An approach that goes way beyond just writing a prescription. So, what does a good, responsible plan actually look like? Well, experts pretty much agree on a kind of pyramid structure. The base of the pyramid, the foundation for every single person, is psychoeducation, just learning about what it is. The next layer up, which applies to most people, is behavioral treatment. And then only at the very tip top of that pyramid, for some people, does medication come into the picture. Okay, but behavioral treatments sounds kind of vague, right? What does that actually mean in real life? Well, it's all about building a better structure around you. So environmentally, it could be as simple as putting a big visual calendar on your fridge. Instructionally, instead of saying go clean your room, you break it down. First, put your clothes in the hamper, then make your bed. And behaviorally, it's about using positive reinforcement, like praise or simple when-then deals. Like when you finish your homework, then you can play video games. These are super powerful, practical tools. Now look, this is not to say that medication is bad or doesn't have a place. Absolutely not. For a lot of people, especially teens and adults, it can be a total game changer. The short-term response rate is really high. We're talking around 70%. But, and this is the big but, it has to be part of that whole package, that multimodal approach. It can't be the only thing you're doing. It's one tool in the toolbox, not the whole toolbox. Okay, so we've established that meds can work really well in the short term. That naturally leads to the next big question. What about the long term? What happens after years and years of treatment? And the answer here, well, it's one of the most surprising parts of this whole story. To get that long-term answer, we have to talk about something called the MTA study. You have to understand this is the big one, the gold standard. It's the largest, longest, most thorough study ever done on ADHD treatment. They followed a big group of kids for more than 16 years. It gave us this incredible, unprecedented window into what really happens over time. And what they found was, honestly, a bombshell. Just a total shock to the system. So in the short term, yeah, medication was the clear winner for zapping symptoms. But here's the crazy part, the paradox. After about 2 or 3 years, that advantage completely vanished. Poof, gone. Long term, there was no real difference in ADHD symptoms between the kids on meds and the kids who weren't. And there was a downside. The kids who stayed on medication for years ended up, on average, about an inch shorter as adults. And that kind of brings us full circle, doesn't it? When you take the shocking results of the MTA study and you combine them with all that data about overdiagnosis, you're forced to step back and ask a much bigger, much fuzzier question. In the world we live in now, with notifications and endless scrolling, the line between an actual clinical disorder and just being a person in the 21st century is getting really, really blurry. So maybe the real question we need to leave you with is this. In a world built on distraction, what does normal attention even mean anymore?